my name is Kathleen Marilis. Today I'm going to demonstrate on how to perform a central line dressing change. First, we have to gather all our materials. I have the hand sanitizer, 2 masks, clean gloves, pen, central line dressing, of course the mannequin, and a waste bag over here. So first I have my hair up. I have my school uniform, my ID, and my nails are clean with no nail polish, no watch, no bracelet, and no rings. So we can start. So first we're going to the patient's room, introduce ourselves. Hello, my name is Kate. I'm here to change your dressing. Patient verified name and date of birth. So then provide privacy to the patient, and then perform hand hygiene. So now that we're ready, we're gonna put our gloves on. And then we're gonna ask the patient to turn their head away from the site during the dressing change, or we can provide a mask for patient. So you put your mask on first. And then you provide patient with a mask as well. So now that the mask is on, we can remove the old dressing. So first we're going to lift the sides of the dressing, making sure that it's all out. You take all the sides first, and then once you take all the sides, you want to make sure that you pull the dressing straight down to the skin, so you don't pull the skin and the catheter also. So then now you're going to toss this out, and so after we pull out the dressing, we're going to inspect the catheter side, the insertion side, and the surrounding side of the skin to make sure that there's no drainage, there's no redness, or no inflammation. So the site is already inspected. So now we're going to remove our gloves. Toss the gloves, perform hand hygiene again, and then now we're going to start with our sterilization dressing change. So first we're going to open our dressing change kit by pulling the opening towards away from you, and then you want to make sure that you pinch the side so it doesn't keep on closing. So then we're going to take our sterile gloves, and then take the sterile gloves first with your non-dominant hand, putting it on your dominant hand. And then you can take the other side by scooping the inside of the gloves. Okay, so now that we are now we started with our sterile gloves, we want to make sure that everything is we're going to stay in the sterile area. Okay, so then we're going to take our chlorhexidine, pinch the side of the chlorhexidine. You want to make sure that you submerge everything that's out, the solution come out of the sponge. So once it's out, then we can start cleaning the area. Take the 2x2 gauze, so you can hold the catheter, the tubing upwards while you're cleaning the area. So how do we clean the area? We're gonna perform the skin antiseptic with the chlorhexidine solution using the friction in back and forth motion for 30 seconds. So we're gonna do 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. So after we clean the skin side, we're going to clean the tubing also. So we're going to start from the bottom, sliding all the way to the top. And then we're going to do the same thing as the at the front, from the bottom to the top. So once you've done that, you can put the tubing down and toss everything on the waistband. And there you go. So now we're ready to put the dressing, the Tegaderm. Since I don't have the Tegaderm, I'm just going to use the Advanced Wound Care foam for the sake of the video. So you want to make sure that you cover the side securely, and you want to make sure that there's no bubbles in the middle, and then you slowly secure the sides by pushing the adhesive down, and you want to make sure that there's no bubbles, and then that's it. So now we can put the label by using our pen. Put your initials and then the date today, and then you can take the label out and put it on the side of the dressing. Okay, so now everything is in place. You wanna make sure that there's no make sure that the dressing is secured, and then we can take our gloves off, and then you can take everything out and toss everything away. And then you want to take your mask off first. And then take the patient's mask off, and then you perform hand hygiene again. And then once you done that, you ask the patients if they have any questions, provide the call light button, and make sure the bed is low. You put the bed on a low position, and that's it. Thank you very much.